I want to talk a little about chronic pathologies, treatment inflammation, and immune dysfunction, the three I's, according to the model of post-COVID, long COVID, which is a problem internationally now, and we are all focused on it for sure. So what about my laboratory? I have the great honor now that I think I'm the only laboratory and in the world which is CAP accredited, which is the highest accreditation you could reach in a laboratory for Lyme disease and co-infections. Normally laboratories have the clear CLIA accreditation, there's included in the CAP. So this standard is now makes it more complicated to attack laboratory test results, also for therapists easier to argument with that. So you can see it's American College of American Pathologists control check us, and so there should be no discussion about the results. And you could see that we have a very excellent quality in the laboratory. They inspected us CAP, and I'm really proud of that. So coming back to the presentation, what we see, let me say more during COVID crisis, as we have seen before already a little, the three I's in diagnostics and therapies. One is the infection, for sure, one is the immune disease, and the other is the inflammation. I can tell you clearly, so if you don't treat all three of these, you could treat fantastically the inflammation, wonderful, but the infection is still inflammation. The infection triggers the dysfunction. The dysfunction triggers the infection. The inflammation triggers the infection. By this complexity, we could get also autoimmune disorder. It's a Th17 pathway, and also cancer. We have a lot of cancer patients now by this inflammatory infections and immune dysfunction complexity. What about this inflammation? It came really evident during the SARS-CoV-2 chapter that during all infections we have in our body, we have good pathogens and we have bad pathogens. We always switch from anticoagulant to procoagulant. So easy to say to you, you can get cold hands, cold fingers. So you have some biofilms. And this is a chapter, I think I'm so happy that Nucleometics has this serapeptase. This is one of the key products to me against the biofilms. Because the infected white blood cells, they are always in the focus. And in my model, I want to show you that this spike protein, we all have heard about that, also during vaccinations, that this plays the main important role in the monocytes, macrophages, as a viral reservoir. So, but this is just a model, please. You can say it's a model for Lyme disease, that's a model for Bartonella, that's a model for rickettsia, that's a model for co-infections, that's a model for all viruses, that's a model for every intracellular pathogen. This is not just specific for SARS-CoV-2. So these pathogens can move everywhere in our body, everywhere. We have good luck with Lyme disease, Borrelia burgdorferi. It's a spirochete which can move everywhere. So it's actively moving spirochete, but it's also intracellular with persister forms around bodies. We also need to treat the biofilms clearly for this pathogen, intracellular therapies, which is pretty clear. But please remember, all pathogens, all infections of us, good bugs, the bad bugs, especially the bad bugs. They can go everywhere by these passive transport mechanisms by the monocytes, macrophages, everywhere, spinal fluid, joints, wherever, heart, mucosa. We come later to that. We have learned during that long COVID story that there's a lot of reactivations of viruses. And one of the very prominent viruses is the Epstein-Barr virus, EBV, and we know that EBV plays a clearly role in the reactivation in long COVID patients, also in Lyme patients, also in other infections, or maybe EBV is one of the leading infections in the world, who knows? This is now pretty clear that EBV is over 280 adults is one of the main reasons, the reactivation. Some name it, maybe you've heard the name opportunistic infection. This is now really one of the main issues we see now for diagnosing and treatment. And I come later, what nutriomedics, what you have fantastic products for that. Also other viruses belonging to the herpes virus group, like varicella zoster virus, the shingles, is getting reactivated, chickenpox, shingles, reactivation. And here are now the symptoms, the prevalence, what you can see in long COVID, post-COVID. You can find a lot of fatigue, you can find a lot of insomnia, a lot of headaches, myalgia, confusion, weakness, rashes, pharyngitis, abdominal pain, tinnitus, fever, lymphadenopathies, hearing loss. So you could say this is a Lyme patient or this is a different infection, who knows? But these are the symptoms, unspecific symptoms of the long COVID patients. And as you know, if you use your products and you're a therapist, you always treat these symptoms, whatever therapy you are doing. Also, if you have an underlying EBV infection without knowing that, which means mononucleosis, you had this kissing disease when you were a student or so, a young guy, these viruses persist in us. I think we never can bring it out. We never can defeat this with any product in the world. We can keep it under control. We can reduce the viral load. We come later to Lee Cowden, what he mentioned to me years ago about that chapter, how we can control viruses. So the infection is in the epithelial cells, intracellular. So the question is, can we really remove the viruses? Or should it be our aim to remove them? Or should we work on the immune dysfunction and the inflammation, anti-inflammatory immune support? So this is the basic question to that now. And we have this on the model of the EBV reactivation. This can be reactivated by SARS-CoV-2 infections. We know that. I showed you the data. It can be exacerbated by SARS-CoV-2. I showed you the data. And if you have an underlying EBV infection, you don't know about that because you have chronic fatigue. You were never diagnosed and treated for that. If it's dormant or chronic or active, whatever, it increases the susceptibility to COVID-19 or to other infections. Also, if you have an underlying EBV infection, you could get easier Lyme disease, as an example. And the immune suppression plays a big role in all of this. We have so many studies about that now, that the CD8 plus cells are decreased, natural killer cell counts are decreased. So, and also now the last point, what I also criticize in the medical communities, the drugs used in the treatment of COVID promotes EBV reactivation. The drugs used in multiple sclerosis, the drugs used in Parkinson, the drugs used in rheumatoid arthritis, they promote reactivations of EBV and other viruses. Why? Because these drugs suppressing our immune system, the pharmacy is suppressing our pharmaceutical products, they suppress our immune system. And the use of these corticosteroids is a no-go to me, to be honest, because we suppress our natural immune system, we suppress our gut system, because the gut is 80% of our natural immunity. We know that now with microbiome, we are working on that. All of these reactivations of the viruses, they play a role later on. Why? Because, as an example, EBV, Epstein-Barr virus, is a chronic fatigue virus. It's a mitochondriopathy virus. So it uses your mitochondria, it makes you fatigued. It's a colitis virus. It lives in your gut, so you have a colitis, you have a problem there. In the mucosa, in the endothelial cells, you have leaky gut, you have food intolerance. It's very neurotropic. It makes cancer, non-Hodgkin lymphoma, autoimmune disorders, Hashimoto's. So if this infection is still active, you will fail in your treatment, whatever you will do. You need to reduce the viral load, you need to bring it into latent phase, come later to that, latency, sleeping, snoring phase, we name it. That's nice to have that virus, to live with it, to say, you're my friend, my virus, bring it back into latency, support your immune system, work anti-inflammatory, and hit the virus, give something against the virus. So to reduce the viral load, we come later to that. So how can we diagnose this? Also one of my specific aims in my life. One of my missions. We are doing the early antigen. So Want to say clearly we need evidence-based medicine for sure. We need studies. We need to publish. Otherwise, we get attacked. And in Germany they try also to destroy the homeopathy as an example. They attack the naturopathic because we need to publish, and also naturopaths need to publish. Otherwise, we don't come forward. And I know Tim and Nutramedic's team, you do wonderful papers also in the past with Eva Sapi, and now you're doing more papers and more papers. It's so good what you're doing. This is the way you need to go. And you can see here the lytic antigen, you can name it. It's a sign for replication. So we live with these viruses. I think we never can destroy all of that parts, but we can control that, and we can bring it back from the lytic phase into the latent phase, the sleeping phase, which is allowed, which is good. And we see that every day in laboratory tests, the early antigen replication of this EBV, but not all patients. I very often hear the words, every patient has EBV infection. Yeah, but not everybody has it active, so that's a difference. And now we know what to treat. We know how we need to bring back this virus away from the EA, early antigen, back to the, in the IgM, you can see that P54 band. So we need to bring it back just into the latent phase. And therefore we have this ELISpot, which is, I think, the best test in the world. We have no evidence-based, CAP, whatever you can mention. So credibility, also we can get attacked by that test. It's a lytic antigen, very high replication. The latent phase is allowed, but not the lytic phase. And not everybody has lytic phase. So pretty clear how the way is going now in evidence-based medicine, and we all want to do as much as possible. And also cytomegalovirus. I know that bioresonance, you can also differentiate a little, the CMV or Hulda-Clark's doing with Zapper. Sometimes the frequencies are similar. Chlamydia borrelia is the same frequency. I've learned from Hulda-Clark years ago. The CMV activation and virus immune dysfunction may be underestimated as a driver, and this is exactly what we are teaching now around the world. And also CMV, the cytomegalovirus, can be the reason for thrombosis. Thrombosis is now more and more the issue. Some clinics doing the apheresis, HELP, HELLP, the HELP apheresis, which is temporarily effective or maybe longer effective. It's apheresis to clean away the biofilms, the sludge from your capillary system, to get more oxygen in it. So this is really helpful against also the cytomegalovirus. But so long the cytomegalovirus is active, you will have that problem. If you don't treat the cytomegalovirus, again, you will fail. Not everybody has active cytomegalovirus. Some have it active, some not. It's also a typical virus which is high contagious in the families. Also, typical fatigue virus. It also blocks your lymphatic system. You need detox. You need verbopinella. This is one of my favorites. We are using internationally, and I recommend every day to therapists in the world. And we have tremendous success with the detox for the liver, for the lymphatic system. So these viruses within the lymphatic system, we name it lymphotropic part of this virus. It's also cardiotropic. It's also neurotropic. It attacks the central nervous system, makes inflammation like myelitis, which is multiple sclerosis. It can do the non-Hodgkin lymphoma. It changes, it alterates, if it's active, it changes, alterates also your DNA structure. It's all proven this, and we have colitis virus here also in the multi-chemical sensitivity group. I worked a lot with years ago with Martin Paul together, and we all said yes, CMV is one of the main reasons for the colitis and the multi-chemical sensitivities in the patient. So you need to know what to treat. If you don't know what to treat, you will fail. You cannot control the patients. It's also food intolerances. It's always the same with these viruses. High contagious, spreading around the family. We're doing the lytic antigen again to see if it's active, and what you can see here, we had a really huge episode of patients, reactivation of cytomegalovirus before COVID. The ELISpot was weekly positive or weak, and after this patient got corona, there was an explosion of this cytomegalovirus, and then you know what you need to treat. Varicella zoster virus, there's a lot of merchandising now in Germany, in television. Yeah, you have herpes zoster, so it's coming more into consciousness. And also COVID-19 can cause the reactivation of that with a bad outcome for the patients. Neurological complications. Also, Justin Bieber has huge problems with it. As you maybe you know, this singer from Canada, he had or has Lyme disease plus varicella zoster reactivation, so he's not able to sing any song, and all of his concerts were cancelled this year. So also these prominent guys, they have a problem with it. I don't know if he's using wonderful nutramatics products. I hope so. But this somebody should tell him. I don't have the access to this prominent person. So also COVID-19, it's pretty clear, can reactivate varicella zoster virus. What is about this varicella zoster virus? It's chronic fatigue virus, mitochondriopathy virus, makes you fatigue again, blocks the mitochondria using your ATP. So you need to support the ATP, also your energy. And interestingly, this is also a virus. We know that it inflames your arterial system. It makes the arteritis. And so we have a huge study of 23,000 patients that these active herpes zoster patients, they get a heart attack, which is 59% afterwards, and a stroke, 35%. So if you had herpes zoster, you have still the problem of the arteritis, the inflammation of your arterial system, and you could get also the atherosclerosis, and then you can get the stroke and so we need to monitor this patient. That's a message, and we need to treat these patients after that. How can we diagnose? Just to mention that the IgA is the key for that. Herpes simplex, herpes on lips also plays a role. Herpes simplex virus, multiple sclerosis virus, it's proven now. Chronic fatigue, also EBV is multiple sclerosis, clearly proven it's doing Epstein-Barr virus now, but it's a complexity of these viruses. Chronic fatigue, mitochondriopathy, always the same. How to diagnose again? IgA. Also, we could do some studies with bioresonance. I've seen that famous therapist is talking also at your conference. It's Alan Baklayan. My greatest honor to you. And we should do some studies together, how we can check this, to verify the method, to bring it into a paper, and then we publish it, and then here we are, nobody can attack us. HHV6, human herpes virus 6, also a problem in chronic infected patients, and reactivations together with EBV. Now we're coming to the chapter that every patient we see has chronic multiple infections. It's not just EBV, it's not just CMV, they all have chronic multiple infections with parasites, with Lyme maybe, with co-infections maybe, with viruses. Everybody has virus infection, I promise. Several virus infections, up to 5 to 6 active virus infections in one person. So it doesn't matter which infection is active now, you need to treat, but you need to monitor if the infections, the activities are going down. So this is the way we are doing now. Always the same story, how can we diagnose ELISpot in this case. Now I want to come a little to prepare you for the gut. The gut, as I mentioned, is 80% of natural immunity, and we have, I think, the most common problem in the world, virus number 1, is the Coxsackie virus, the enterovirus, which is named the Coxsackie virus. It can go everywhere in your body, and also we see a lot of patients, they believe they have Lyme disease. They don't have Lyme disease. They have a Coxsackie virus infection in the world. Also the echovirus, it's high contagious. And interestingly, these viruses, the enteroviruses, made the gut inflammation. They were found in ME, myalgic encephalomyelitis, chronic fatigue syndrome, the subtype B1, and they survive in the mucosa in your gut. They survive, they are still there. So we live with that, and then they spread around your body. We need to treat them, we need to keep them under control. We need to treat the gut, otherwise we will fail, that's the same. And this is very interesting. Please, if you're a therapist or in your networks, ask all of your patients, show them this picture with this herp angina, and you will not believe how many of your patients, they have this hurting blisters in the mouth, and they're coming and going. This active infection persisting in the body, coming out. The skin is the surface of our inner organ system. So you reflect it sometimes outside, like the herpes labialis, or the herpes in the genital tract, herpes simplex virus 1, 2. This is coming out. Please ask all of your patients, and you will find a tremendous number, and you will be surprised. And this is a Coxsackie virus infection. You can be pretty sure that it's not under control. It makes diabetes, it makes autoimmune, it makes a lot of this. It's neurovirulent. We have a huge problem with that. And this is what I want to show you, all of the symptoms. It's chronic fatigue virus, also mitochondriopathy, and so on and so on. Neurotropic, makes a lot of inflammation everywhere. The echovirus, always the same. ME, CFS, it makes meningitis, paralysis, pericarditis, and so on and so on. I cannot go all into this deep symptomatology because we have developed a specific tool for that. The IgA is the key. IgA antibodies. You will find all of them out, and you can monitor them. IgA has a half-life time of 2 weeks, local inflammation, inflammatory IgA in the gut. This is what I see daily with my patients. I diagnose now 100 every day in my laboratory. Let me say 95 active Coxsackie virus and echovirus and double infections, and also the other viruses together with it. So I am now getting more and more the virus expert for that internationally, but also don't forget the mycoplasma. The mycoplasma and the chlamydia and also need to be treated. These are bacteria. Now it's bacterial. They live in the mucous membranes. We're coming again to the chapter back with the respiratory system, the intestines, the vagina. They live in that, and they can be transported everywhere. Garth Nicholson did a lot of studies, and mycoplasma also in autism, ADS, ADHD. We all know that neuropsychiatric, and they can be transported in the macrophages everywhere around your body, all in the spinal fluid. Maybe some of you remember the Guillain-Barré syndrome, GBS, which is a highly tragedy for the patient, really very aggressive form. Chlamydia pneumoniae, and Tim, you know the story of the koalas, which are treated, and I think also for your products, for the vets, it's very interesting. Maybe you treat the koalas for the chlamydia pneumonia infections with Samento, Banderol, or Stevia, whatever you can have for this chlamydia pneumonia infections. Chlamydia pneumonia, it's coughing, it's everywhere in the body. Not everybody has this active. I would say 90% of all of us, we had this, or 95% or 99%, but not all of us, we have it active. It makes a lot of neurological disease, Alzheimer's, multiple sclerosis, schizophrenia, atherosclerosis, again, we're coming back to the arthritis complexity, the asthma, the cirrhosis, diabetes, arthritis. It was found in the rheumatoid arthritis, this pathogen, this bacteria, and the reservoir is still there, monocyte, macrophage. So the model is everywhere the same. So we need the monocytes, macrophages, but on the other side they are not so good because they are the transporters for all of these pathogens. Oxidative stress, inflammation. Treat this. Treat the oxidative stress, inflammation, because this is associated with cardiovascular disease. We all know that. Because if you have a chlamydia pneumonia in this complexity, it does the oxidative stress inflammation. It's just a model, please. It could be also chlamydia plus mycoplasma, it could be Bartonella, it could be all of these pathogens doing that. It's not just the topic of chlamydia pneumonia. What you can see is the model, how it works with this activation of the thrombus formation, called hands, called fingers. Some are doing ozone, oxygen therapies to support this. Again, you need for sure biofilm brackets. Okay, so this is a must do. I think it's absolutely 100% of the patients should do that, and they need it. And there's a high percentage of respiratory problems with asthma, allergies, although asthma where you have or you have this allergy now with this inhalation. You have chlamydia mycoplasma on the other side, and we know that SARS-CoV-2 brought into our consciousness, yes, we have that problem with chlamydia mycoplasma, which we saw before. And the immunoglobulin A antibodies, these are the key, because this is not normal. They have two binding arms. There's a bigger protein in our body, and the IgA is the only mucosal marker we have in the whole immunology. It's an excellent immunoglobulin. It helps your immune system, but it's reactivated, and in this reactivation, you get more protein. But if you have it, it's quite not normal, and you need to bring it back just to IgG antibodies. And a lot of doctors, they are doing the IgM antibodies, also for chlamydia pneumoniae, it doesn't bring it forward. And we have here this stroke. 2011 came a huge study that chlamydia pneumoniae is doing the stroke, so we need to check IgA in chlamydia pneumoniae patients. And this again, what we see every day, we could also do a study together with the bioresonance therapy and diagnostic tool together to find out is it IgA positive or not, and do evidence-based medicine study. What we see here, chlamydia pneumoniae active and Coxsackie virus active. So now I want to come to the end with this chapter. We have thought about that during crisis. We did some different blood-taking viral reactivation panels, and I would be happy if I could serve a little for paramedics with this to make it easier to diagnose that. And also we have advanced panel for that. You can see all of these bad bugs in our body, which could be good bugs if we control them. So if we could arrange, they are not doing anything to us. And then we developed this post-COVID checklist 2-3 years ago, because it was pretty clear that before all of this paperwork came with the EBV, it was clear to me that this is a reactivation of different pathogens, EBV, CMV, and by this diagnostic tool you can get it free of any cost. Also, this is a clinical tool. We should also do studies on that with bioresonance. It's just an offer to offer other new group doing some other therapies. So we need evidence-based medicine, we need inclusion criteria, exclusion criteria in the studies, and otherwise we will not come forward what we do. So now about therapies. This is what you are interested in. You have learned, you've heard all of these pathogens, yeast and mold, I forgot, we have a lot of Candida and Aspergillus reactivations also. These infections, the parasital infections also, this is too much now to talk in 40 or 35 minutes. We have immune dysfunction, we have inflammation, infection, and we have also what I forgot a little to mention, the stress factors. So the stress plays, I think, the main important role. External stress, internal stress. The Romans, they said, mens sana in corpore sano, a healthy mind in a healthy body. I think this plays also a very, very important role to support this. I know that Nutramedex has wonderful products for that. We have the autonomous nerve system. We also have an elevation of the catecholamines, adrenaline, dopamine, cortisol plays a role, noradrenaline, we have the prolactin, the immune system, the cytokine profiles, we're working on that, Th1, Th2 balances, immune dysregulation. We need also to do a good regulation of the Th1 to bring it in a balance back again. And this plays, I'm also endocrinologist from my history, I did my PhD in this field with all these hormones, so they play really important role. And in the end, we all know, if we don't look at the hormones, the hormonal axis, and we don't compensate Th1, Th2, then we don't compensate the anti-inflammatory or the inflammatory cytokines with anti-inflammatory products. We have sleeplessness, we have anxiety, we have mood swings. So we have all of these problems, and that's for sure. The infections play a very important role. Not just infections, also electrosmog, 5G, environmental medicine, genetics, epigenetics, all know that. It's killing the onion model. And the adrenal fatigue, Also adrenal fatigue. Adrenal fatigue, I just can mention that 100 times this need to be treated. Now, what are the therapy options? I thought about that some years ago, and I started with that 10 years ago. The immune system needs to be treated. We need the biofilm breakers. We could do a lot of immune modulation, vitamins, minerals, probiotics, chelation, detoxification. We have the herbal products from you. We have also some other alternative pathways. I'm serving 1,000 therapists around the world now with my laboratory services, and I know what they are doing. A lot of these therapists, very interesting methods, and I'm on the standpoint what the method which helps the patient needs to be accepted. If you fail to help a patient within 2-3 months with your option, please give the patient a different option. And I think also this should be one of the aims, not to sell just the products, to be honest, to be fair, to say, okay, 2-3 months, if you don't get Herxheimer reactions, also viruses can do that. Change your model, rethink about that, maybe add something, modify something, doing something else for the patient. We name that in cancer treatment the staging process. Never leave the patient alone, say, take a 9-month protocol and then it's good. That's not the way. We should always stage, we should modify, we should individualize as much as we can. Vitamins and probiotics, this is also a chapter we learned during SARS-CoV-2. Vitamin A, the vitamin B complex, important. Vitamin C, we're doing a lot of infusion therapies here in Germany with high-dose vitamin C. We have the vitamin D now, that became very famous during SARS-CoV-2. And vitamin K1, vitamin K2 is absolutely belonging to that. Magnesium, the coenzyme Q10, essentially fatty acids, omega-3. This is just part of it. So I'm not the absolute expert. You have better experts in the world, but I know now from my networks that this may be a summary of what most of the therapies are doing. And the vitamins play a role for sure. Vitamin D with the sunlight is a problem. And the probiotics, prebiotics, use them for sure. That's a must do. Now I'm coming how we can support the Th1 cells. And this is a slide, I don't know, Tim, if you gave me that slide or it was from Lee Cowan. We did some presentation together in Hungary and Romania years ago. Some funny stories we had there. And also what I can tell you, the Samento, which is here, it's one of my favorite products. Also, I always, you cannot see that, but it's Samento. Here on my table, I use it also. Samento, to help me, it's really perfect against the bacteria, working also for Lyme disease, all the bacterial chlamydia, mycoplasma. We have the Comanda, which is also a perfect nutramedics product we use also against the viruses, also against bacteria. So it's broad-ranged herb we can use. The quina, it's also I have here on my table. So I got all of this from Tim some months and years ago. So my favorite products, I use it myself because of my Coxsackie virus story. The Noni, Tim recommended to me the Banderol, Samento Banderol. Ifasaki did this perfect study together with Lyme disease and the stevia. Really great product in this complexity treating bacteria. Stevia, Samento, Banderol. It's a must-do. It's a must-have. The berberry, also perfect to support the Th1 cells. The procyanidin, the melatonin, the DHEA, selenium, zinc, and magnesium. We have a lot of these. And also what I'm doing is the natural boost from Tim from Nutramedics for Men. I'm using this one, natural boost. You cannot see pretty well, but you know what it is for sure. And the Tangarana. I have the Tangarana here, also against my viruses. I come later to that chapter, what I'm using. I'm a living example how you can treat successfully viruses. And let me say so, Nutramedics rescued my life. So I'm really proud of these products, to have them prophylactically. I use them every day, not all of them, not the whole protocol. So I'm an own therapist for years now with my Coxsackie virus and other patients I treated successfully. We have cured a patient, interestingly, with 20 bottles in 1 week with stevia from Lyme disease. We have cured this patient, and 20 bottles, and I messaged that time to Lee Cowden, and Lee messaged back to me, yes, it was a higher bacterial load, he thinks, and the patient is cured until now. There is 20 bottles in 1 week. That's atypical, very, very sweet, but in the end, he was cured from his Lyme disease, from his massive fatigue. He was a businessman from Netherlands also. Yes, these are all some really good examples to herbal support. I show that also in many of my workshops I do around the world. I don't say this is now nutrametrics, but because in some CME I'm not allowed doing that, but I mentioned that. I need additionally more information also from the nutrametrics team. How could I add that, a slide for that, to promote these wonderful herbs which rescued my life. And also we have the herbal support for the Th2 cells, the myrrh, the statins, the progesterone, and for the adrenal fatigue, we mentioned that already. We can use the Gisandra. I don't have it here, so I don't have some massive fatigue, so I'm not using that actually. Gisandra astragalus, rhododendron, caucasium, difficult word, ginseng, rhodiola, and against the stress anxiety, we have the amantilla. I'm not using that actually because my sleep needs a little DHEA and melatonin specifically. So we don't have wonder drugs for everybody. So you need also to try it out if it helps the patient. I don't know, Amantilla helps the patients, use it, try it out. Gives you a patient, you have tremendous success with it. And this is the study where I get from dramatics some years ago, 2015, 8 years ago. Stevia, it's really, I mentioned the case to you where I cured a patient, 20 bottles in 2 weeks, so that was a lot. That was not the dosage recommended, but he tried it out and he got cured from that. So that means maybe we need individualized higher dosages or maybe lower dosages for the children. I know we should use 50% or less. We get a lot of tremendous Herxheimer reactions. Also, Herxheimer means the patient is feeling worse with Lyme disease, with viruses under that treatment. The co-infections, Bartonella is doing that. The second and third week, it's most the climax, but then the patient needs little reduction of the herbal dosages. That's my experience, but you're the expert, you know better. So natural remedies like you have, or Nutrametrics is presenting, is really an option. It's more than an option to me. It belongs to one of my recommendation I message around the world. It's the Lee Cowden protocol against viruses, I named that. Okay, I know that maybe not your strategy, but I named that years ago because I said we need to treat the viruses. That was pretty clear with my own case with the Coxsackie virus. And I talked with Lee Cowden and he said, yes, Armin, take the Tecuna. Tecuna came brand new on the market that time. I used the Berberrinella for the detox, the Samento, the Serapeptase, and the L-lysine. I'm taking also myself L-lysine, 1000 milligram every day, in this complexity of treating the viruses, which are reactivated, which are opportunistic, doing a lot of your symptoms. And he did this email to me, Lee Cowden, that time for Coxsackie, EBV, and CMV. Dr. Cowden recommends the Cowden Support Program plus Tecuna. For patients with high viral loads, he recommends 30 drops of Tecuna 4 times daily or 30 drops twice per day for patients with lower viral load. So you can see here the individual component in this therapy, and I think really maybe you start with drop by drop. That's my experience with a lot of patients with infections. I'm just talking about infectious diseases. I'm not the expert what you're doing in your fields with maybe some other issues, problems, symptoms. If an infection is active, I'm going that way. Stevia you could use additionally against chlamydia, mycoplasma, Plasma, Samento against chlamydia mycoplasma, which is very, very common in the world, Banderol against chlamydia mycoplasma. So if you could add that. This time, I think Hotunia was missing in this email or this recommendation. This is serrapeptase. I don't need to repeat it again. Use the serrapeptase. It's a must to do that. We need this, drink a lot, and I know that you need to drink 3 liters water every day without gas. Otherwise, the herbs are not working. I could not believe that in the beginning, but that's the truth. So I tell every patient, please drink 3 liters basic water, which means anti-inflammatory diet. Also, this is a key, the nutrition for the gut. Use just the water without gas, no sugars, no alcohol, nothing in it. And this serrapeptase, I think it's a must-do in this biofilm, in this coagulopathies of the patients. You need to do that. And that is the Tacuna. I'm a fan of this, to say it simply, in the combination with Hotunia. I do it every day for 9 years now. And I swear, I had this Coxsackie virus with bad gut issues. I have a leaky gut. I have histamine intolerances, which is coming out of that. I have lactose intolerance. I have this IgA, had this very high without knowing. I took antibiotics. I thought I have Lyme disease. I destroyed my gut, my complete flora there. I was born in the 60s. My generation, we all got this penicillin every infection we had, but I'm sure it was a Coxsackie virus with a herb angina that time, and my parents gave me the penicillin, and I'm surely resistant. My gut was destroyed over these decades of years, and then I came to this Coxsackie virus story, and I am suffering from that. It's up and down. Sometimes now it's better, it's stress triggered for sure. I had a reactivation during Omicron last year when I had this infection. It sucked completely my energy, and since then I have very low level of IgA antibodies, which is not quite normal. I'm working on that. And inflammation, I take every day Tacuna and Hotunia. Hotunia you can see in the book from Stephen Buhner. You have all the literature behind that, all the evidence-based paperwork. You need this. Stephen Buhner died, unfortunately, this year. The Hotunia is one of my key herbs in the combination against all of these viruses, the combination with Tacuna. This is the key to cure so many patients with leaky gut. It's not alone these 2 herbs, but these are the key products to me from your company, and I take them myself every day. My wife is taking, she's a naturopath, very famous in Munich. She's taking every day. We had so many patients, you cannot imagine, and every recommendation is based on your products, guys, in Canada, in America, in whole Europe, in Australia, and they don't know about that. That's interesting. In the book from Stephen Buhner, you can see all of that where I mentioned. The next chapter, to me, coming to the end now, it's the mycotoxin. We are working together with Professor Gilbert in Finland, and she has developed this Toxiplex because we are so full of mycotoxins. You cannot imagine that. We are so full of yeast and mold. It's horrible. I have a lot of therapists. I'm doing tests in British Columbia, and they said to me, the main problem here are the mycotoxins. I said, no, you have Lyme disease. No. Mycotoxins. And also the viruses, this complexity of this chronic multiple conditions. And this is the first test, the quantification with an ELISA. It's done from blood, easy test. We have a high accuracy, precision, specificity, and a very low detection limit. Results are very fast available. Also, I want to do a little marketing for some innovation we are doing on our side. And you can be sure that my heart is completely with the Nutramatics family, with the Eaton family, also with the Toothman family. He retired, Mark. These are my friends for years now, and they helped me to get my health back, not just for myself alone. So you have here a person behind you, which seems to be a laboratory doctor, but I'm more than that. I'm a medical doctor, I'm a therapist, but I want really to give something back where nutramatics helped me, and I think millions of patients will work. Thank you very much for your attention.